We welcome you on this edition of Max Doc Talk. World Breastfeeding Week is celebrated every year in August. Since 1992, the overarching theme of this week has been to highlight the importance of breastfeeding and to promote breastfeeding and improve the health of babies and mothers all around the globe, focusing on good nutrition. In this session, we will interact with Dr. Manju Khemani, Senior Director and Head of Unit Obstetrics and Gynecology, Max Smart, to answer some of the most frequently asked questions around mother and childcare and delve in the joy of motherhood to learn about breastfeeding and its importance for newborn. Ma'am, we welcome you. A common question asked about breastfeeding is, can it be painful?
So breastfeeding is not painful, but yes, for some women it could be painful. And why it is painful? You know why? Because they are not positioning their baby well. So they developed cracked nipple. So correct way of breastfeeding is that they have to breastfeed not only on the nipple, but the baby has to suckle on the areola. So baby's chin has to be so close to the mother's breast that baby's chin is almost touching the mother's breast. If baby is held in this particular position, then there is a no stretch on nipple and mother is unlikely to develop cracked nipple. Some women, they always complain of pain during breastfeeding. Some of these women may have underlying depression, so one has to investigate on that point of view also. But for majority of women, breastfeeding is not painful if position of the baby is correct.
Doctor, what would your advice be for ailing mothers? Should they breastfeed when they are sick? Is there a possibility to pass it on to the baby?
So it depends what mother is suffering from. Like, even during COVID, now they say that, you can breastfeed the baby. Only thing is that you have to take precaution that you wash your hands, you wear a mask. So it is actually a myth, In majority of, common illness like diarrhea, UTI, one can breastfeed the baby.
And as we talk about the baby and about breastfeeding, can babies still have breast milk when they start to eat solid food?
So usually we start solid food when baby is 6 months of age. Even at this time, mother should continue breastfeeding for the next 6 months at least till the child is 1 year of age, because 50% of nutrition will still come from mother's milk. So why deprive baby? So breast milk has to be given to baby at least till child is 1 year, even when you have started solid food.
And some common myths that revolve around breastfeeding suggest that breastfeeding is hard work and takes too much time and energy. Is this true?
Time, yes, definitely I'll say. Energy, absolutely no. Because just think, you have to sterilize the bottle, you have to boil the milk, you have to make sure that your child doesn't develop infection, everything is neat and clean. Afterwards, you have to clean the bottle. So I think that's much more hard work than, breastfeeding. Yes, time definitely you have to give to the baby. But then it's worth it because you are giving so much of benefit to the baby. Baby is psychologically more secure to the mother. Baby gets all the antibodies from mother. So baby is protected from these common infections which, once baby is getting these antibodies. All the baby's nutritional supply, that also comes from the mother's milk. Plus mother also has so many advantages. Just think, you are protecting yourself from breast cancer if you are breastfeeding. You are protecting yourself from ovarian cancer if you are breastfeeding. The chances of diabetes and blood pressure are also less. So there's so many advantages. It is worthwhile to give this much time to the baby for the breastfeeding.
When we talk about the health of the mother, a common misconception revolves around sleep. Is it true that moms who breastfeed don't get enough sleep?
To some extent, you are right on this point, but that is only in the first 2 weeks, 3 weeks or 4 weeks, because initial 2 to 4 weeks babies don't sleep in the night, they remain awake, and every 1.5 hours they need milk. But mother can catch up the sleep during the afternoon. After 4-5 weeks, babies, they start sleeping, they sleep from in the night from 11 to 5, varying from one child to another. So mother does get adequate sleep. So it's a question of only the initial 4 to 6 weeks till, child is adjusting to you, you are adjusting to the child, and child is learning to sleep at night.
Another important misconception about breastfeeding is about the food intake during lactation. What would be your advice on the nutritional intake of mothers when breastfeeding?
So when you are breastfeeding, you need 500 calories extra, right? And so to have that kind of calories extra, in good old days, mother was given, those gaun ke laddu, she was also fed on, halwa, panjiri. The one, this thing advantage of all these food which is rich in ghee was, that mother was getting, that kick feel, that feeling good, that's why. But these days, and in the previous, past years, the food supply was also not adequate in every family. So that's why mother was given. So nowadays, you should concentrate more on, milk, because it's a very good source of calcium. You must take 2 to 3 servings of protein. You need that. At least 2 fruits, lots of salad, whole grains. So make sure that you are taking adequate carbs, proteins, healthy food.
We talked about nutrition. Can medications be taken while breastfeeding?
Some medications are safe, routinely used medicine like, cetazine, but crocin, Voveron, but some medications are absolutely contraindicated. So before popping any pill, you must ask your doctor whether this particular tablet is safe for the baby or no.
Also, some other myth about breastfeeding revolves around the size of nipple. Does the size of nipple determine if a mother can breastfeed?
No, this is again a myth, so because baby has to suckle on the areola, baby does not have to suckle on the nipple. So even if your nipple is small, you can still breastfeed the baby. Sometimes what happens, the nipple is absolutely inverted. That also can be corrected by, some syringes are there, some nipple puller. In case there is too much problem, then there are nipple shield which covers the nipple area, and then baby can be made to suckle, and over the time baby learns to suckle from the mother directly without the shield. So whatever may be your size and shape of nipple, breastfeeding can be done provided you are motivated.
We talked about motivation. Many women think that they have insufficient milk. How does one know that they are producing sufficient milk for the baby?
Yeah, this is a common question, I hear from this thing patients, and they stop breastfeeding only because of this reason. No, I've started giving one top milk to my baby, and this happens, when the suckling is not enough. It's a myth that if I eat this is like a lactogogue and this will produce more milk. No, the milk is produced when the child suckles for 8 to 12 times in 24 hours. That means even in the night when your child is, waking up and demands milk, you should breastfeed, because it is the night suckling which produces a hormone which is called prolactin, which causes more milk production in the daytime. So if you start just one top milk in the night and child sleeps for 3-4 hours, so that suckling is gone, then milk will start producing less. So how do you know that your milk is sufficient? If your child has passed urine 6 times in 24 hours, if only on your milk child is able to sleep for 1.5-2 hours, that means your milk is sufficient. And if your baby is gaining weight, of course.
Thank you so much for this session. As we leave, what would your advice be for young mothers?
So I would suggest, that during pregnancy, learn these, join these classes which are there to help you to know all about breastfeeding. And you should be motivated to give best for your baby, so that your baby does not have allergies, asthma, baby is psychologically secured, and you have so many benefits. All this can be done, little bit of hard work, and you will have the success.
Thank you so much for joining us for this live session. If you have a question, feel free to drop it in our comments. We thank you for your time, Doctor.